I welcome our distinguished guests, teachers, and students to the launch workshop of the new initiative that is promoting science and health communication through outreach and capacity building of school students and linked communities, which is catalyzed and supported by National Council for Science and Technology Communication, Department of Science and Technology, Government of India. So, the rapid spread of COVID infections across the globe in early 2020 reminds us of the deeply connected and globalized world we inhabit. COVID-19 pandemic has grimly impacted communities and individuals across the globe and has left serious consequences with it. With the pandemic becoming the new norm of existence, TERI has realized to facilitate the new normal and help the stakeholders to learn and adapt to the unprecedented changes. In the light of the above, TERI, in partnership with National Council for Science and Technology Communication, Department of Science and Technology, Government of India, has initiated this program titled promoting science and health communication through outreach and capacity building of school students and linked communities. The objectives of this program are largely to make efforts towards building capacity in science, health, and personal behaviors amongst the young brigade of the country, along with their linked communities, and to develop scientific temper amongst educators for adopting sustainable, healthy lifestyles. With this brief background, I would request Dr. Livleen K. Caron, Associate Director, Environment Education and Awareness, TERI, to kindly deliver the welcome address. Over to you, ma'am.
Thank you, Tanvi. Um, it's a pleasure to be speaking with all of you today, and a special pleasure to see familiar and lovely faces of Bharti ma'am, Rita, my colleagues at TERI. It is nice, this is an opportunity to be able to connect with all of you. And I see 253 participants listed for this program. So excellent work done by the team, and thank you to all of you who are with us now today. So taking forward what Tanvi has just spoken about, this is in fact the formal launch of our project promoting science and health communication through outreach and capacity building of school students and linked communities. TERI has a very long association with schools, over 2 decades for now. So we have been in touch with you through a lot of projects happening across the country. One of the leading programs that most of you would have enrolled at one stage or the other is Green Olympiad. And Green Olympiad is one activity which is happening in all states and UTs of the country. So today we have participants from Delhi NCR, Calcutta, Bangalore, Bengaluru, and Mumbai. But I am so hopeful and sure that the spin offs of this ambitious and important project will slowly percolate to all parts of the country. The timing of this project is so perfect. We are right in the middle of the pandemic. We are all talking about, reading about issues like disease surveillance, case tracking, contact tracing, communication, miscommunication. All of this is happening all around us. And in the middle of it, we are not able to go to schools. So, what do? We do not have access to our teachers on a regular basis, to the school library on a regular basis, and we do not have that advantage of a peer-to-peer discussion with our fellow friends. So this is an opportunity, this is one of the opportunities being brought to you in which while we remain at home, we will be able to know about sustainable lifestyles, healthy lifestyles, health related positive actions through a lot of fun and no activities. My team is going to share with you more information about the IEC material, documentation, report patterns, but the overall arching goal of this project is knowledge to action. You read the newspapers, at times you may find that what we are speaking under the project is something that you already know. but at times you will also see critiques or contradictions to the information available. We will find opportunities to link you to medical experts, to outreach experts, to teaching community who will be able to guide you better. So don't feel that you are isolated and all alone, and here comes another burden on you to be a part of this project. This is going to be a platform of give and take. My colleagues are designing very robust online platform where you will be interacting, you'll be able to showcase your own beliefs and actions related to certain related health issues. So here you look on for more engagement, be a part of the TERI family, enjoy, learn and enjoy through this experimental project. And I would also like to say that this has been made possible by NCST segment of DST, which is the National Council for Science, Technology, Communication. This is again a very robust organization which is conducting several outreach activities related to science and technology communication, development, production and dissemination of SNT software. Very beautifully designed, innovative incentive related initiatives and a lot of focus on science communication. So the government has launched very ambitious policies which are targeted. We are aware about the NEP, the National Education Policy. We are going to see a lot of changes happening in the school ecosystem. We will be moving away from the rote learning of textbook and boards and writing. And here is a project with experiential learning platform being made available to you by TERI and NCSTC. So sit back, relax, listen to what we have in store for you and be a part of the project. Thank you so much for joining us. Thank you.
Thank you so much, ma'am. Very rightly said, this is going to be a platform of give and take. We will be sharing experiences, we'll be taking your experiences. So, this is going to be a great project for all of us. So, with this, I would now request my colleague, Ms. Taru Mehta, Fellow EEA TERI, to familiarize all of us with this great initiative. Over to you, Taru.
Thank you, Tanvi. Am I audible?
Yes.
Okay, let me share my screen. I hope this is visible.
Yes.
Okay, a very good afternoon to all of you. We warmly welcome you to the project launch. This is a project, as you have already heard, supported by DST. I'm not going to again repeat the name of the project. It will take some time to all of you to remember the name of the project. It's a lengthy one. So, and I'm thankful to all the students for participating in big numbers. It's really overwhelming for all of us because I know all of you are burdened with so many online activities, and it's really hard to choose which one is more important than the other. So, thank you once again, and we look forward to connecting with you throughout this year with lots of interesting activities and competitions. Starting with my presentation, I would like to begin the presentation by quoting Adre Ozele, DG UNESCO, on how she thinks that education still continues to lag behind while we are dealing with COVID-19 crisis. Had there been enough education and people knew the importance of dealing with stressful situations, life in the current scenario would have been much easier. Also, if you see that in her opening sentence, she has really put a stress on the first challenge while dealing with any kind of unprecedented changes. So, what here she's trying to say is that whatever we do or whatever we face in our current circumstances, education is one thing that will take you through the places, take you through the solutions, and help you with managing the change. Otherwise, if we are not aware, if we are not open to ideas, if we are not open to the communication that we are accustomed to, of what we are accustomed to seeing, life will be very, very difficult. So people at the helm of affairs also are talking about why education is important to deal with a crisis like the current times. Moving on to the rationale of the program. Now, why this program is, we thought about such a programs. We all know that, you know, we have to follow COVID-19 appropriate behaviors. These are life changing habits, life saving habits. But a question to all the students present here: how many of us are religiously practicing, social distancing and masking after the second wave has slowed down? Yeah, could we see? Could we have some responses in the chat? How many of you are religiously following the COVID appropriate behaviors while the second wave has now slowed down a bit? The answer to this question is that, though we think and though we know that all of these behaviors are important, but that sensitization towards such an aspect is missing from the point of view that we sometimes feel that it is very critical because we are seeing apathy around us. And sometimes when the news channels tells us, okay, the cases are going down and we are opening up, lockdown is removed, so we are trying to pacify ourselves by saying that, okay, the situation is okay, it is under control, and I can exercise some bit of no control over all these aspects. That is wherein the sensitization comes into picture. Another aspect that we believe is necessary to learn are the related topic that has significance in the whole COVID-19 scenario. Whether we are talking about water, sanitation, and hygiene, all clubbed together as WASH, or we are talking about SDGs, or we are talking about science communication, myths around COVID-19. So all of these topics will be center of discussion within the project. Also, the aspect of how to deal with stress in such times will be taken into consideration, because it's very rightly said by WHO that a complete sense of a healthy person is just not by the physical health of a human being, but also social and mental. So when I say mental, it means that we know that the situation is there and we are prepared to counter that problem. While the social health would be our relationships with our neighborhoods, our relationship with our immediate surroundings, with our relatives. We are not going out, it's lockdown. So, how are we to deal with such a scenario? So, all of these things will be critical to this project and critical to the learnings of this project. There was other immediate reason behind undertaking this project was that adopted we have adopted current crisis as a top down approach. We know that it has come from above, that lockdown is necessary, masking is necessary, and virus is mutating, and it's changing forms every month, every week. So all of this is known to us, but do we know the science behind it? And if we know the science behind it, do we really understand it? So so this aspect also we thought was critical to the genesis of this project, because we know science is critical, but understanding science into common people's language is also one of the most important aspect. So all of these things were critical to having the idea of this particular project. Hence, the objectives you see are very clear. I hope you all can see my screen. The idea behind the cause of this project is that we sensitize students, and through students, we reach out to the communities, to the parent community, to the relatives communities, so that COVID appropriate behaviors are followed and other related risks and other related terminologies are also taken into consideration. The project also aims to make to create ambassadors of change in amongst the students, so that they becomes our arms in reaching out to many other people. We also aim to develop a lot of interesting knowledge products. As Livleen already mentioned, we are developing right now, currently developing the content under this program. A portal has been developed, which my colleagues would be talking about. So all of these products are developed to aid the learning process, to aid the teachers to translate the learnings on all these aspects which I just talked about. Another aspect is also to inculcate scientific culture amongst the students. Now, when I say scientific culture, what I mean is that we simplify the science behind all the concepts and relate it to the social aspects which are available. Moving on, so the target group under this particular project, we've already been in touch with the teaching fraternity. All the teachers were in touch with us. They already know the target group. The project is reaching out to 30 schools each in New Delhi and NCR, Bangalore, Mumbai and Kolkata. Directly, we will be designing interventions for school students and teachers. And through our competitions and school action projects, we will be reaching out to parents and school administration. Neighborhood communities is though an indirect target group, but we would try to reach out to them through our online interventions such as portals, social media, etc. Uh, Now, as it was said in the beginning, that the activities of the project are aligned in a way that the sensitization would, of course, happen, but we would also see how this sensitization is translated into action. So clearly, under the project, all our activities divided into three pillars. One is imparting knowledge, which will be uh, you know, uh, directly taken care by the workshops that we are planning in our coming months, the portal that is developed, and the resource material that is being developed under the project. Building skills and competencies. Now, when I say skills and competencies, it's very critical to understand that the current times are not the normal times, and people face stressed situations. We are all under lockdown. There is a burden of achieving good marks in studies. There's a lot of pressure on elders to go to offices and build up on our targets. So all of these aspects has built into some kind of stress or the other. So we would be talking about leadership, we would be talking about emotional intelligence. With teachers, teaching has become a stress, so we would be talking about artificial intelligence and virtual reality. So whatever new elements that have come up under this particular scenario, we would be discussing that. And this would be achieved through workshops for teachers and lesson plans that they would be coming up with. And we would be expecting them to translate these for their students, so that even students are involved in the skill building process. Enabling action. There has been already, we have started this particular aspect in our project. We've already done one of the competitions. Enabling action would mean that we would we would ask our students to participate in the regular competitions that are happening. So one is, of course, comic strip. Most of you would be waiting for the results to be out. So that will happen soon. I'm seeing the chats that students are asking when will the results be out. So it will happen in the later part of the workshop. So every month we will be having competitions, and then there will be school action projects which will be led by teachers and a group of students. And every month, whatever activities will be planned, my team would be reaching out to all of you and would be giving you information on all the events. So as I said, we are developing a lot of content. So these are some of the resources that are already developed. uh, these are some of the project brochures and posters, which brochure is already being sent to you. If not, then we would be sending these to you. And this is also These are right now in soft copies. We would be printing them and sending it to your schools. There is a portal, as I said, that was developed. We would be talking, my colleague would be talking about this also in the later part of the workshop. Just to give you a run through interventions in July, we did a first round of contest, comic strip contest, and we got a phenomenal response. I think we got close to 600 entries from students, and trust me, the judges found it really, really difficult to judge the best 3 entries. Launch event is happening today, and there are other workshops and plans for August, which Tanvi will be talking to you in the end. Talking about expected outcomes of the project, uh, you've already learned about the objectives. Now, the outcomes which are here is that we want to reach out to as many students as possible from the 120 schools in total that we are targeting. The reach is from classes from the age group of 12 to 17, but that doesn't mean that these students cannot reach out to younger or senior students, so they are free to do that. We want to create a cadre of empowered students who can reach out to the larger community. We are developing a lot of resource kits and portals, etc., which we want our students to use up till the maximum and be in touch with us throughout the project duration. Implementation of action projects. This we would be talking more in detail once the time comes. That this will be launched somewhere in September, and of course, dissemination of fact-based information to our larger audience. So these are some of the expected outcomes that we envision out of this project. Last but not the least, so this is my project team. I am not sure why the picture of Miss Rita Sharma is not coming. Rita ji, probably you could show your image while coming on the video. There's some problem. So Monmi, Tanvi, Ravi, and Harika are in touch with you directly. They are our city coordinators, and rest of the team, of course, is there to listen to you, to speak to you, to solve all your problems. Thank you so much. It was lovely speaking just on the one side. Had it been a on-ground workshop, I would have got the opportunity to really interact with you. But yeah, we welcome all the questions that you have. And even if you come across any questions after the workshop, please feel free to write to us. Thank you so much.
Thank you so much, Taru. You have very nicely explained the project details to all of us. And I'm sure with time passing and, while we do activities, students will gain a little more, idea on how they have to do, what they have to do. So thank you again. And with this, I would like to now request Ms. Bharti Mishra, education consultant and former PGT biology, Chiranjeev Bharti School, Gurgaon, to kindly deliver a talk on the science behind a virus. Ms. Mishra is master's in botany with B.Ed and has been an educator for more than 30 years. Besides this, she has been a mentor, an environmentalist, and is an eco warrior. Over to you, ma'am.
Thank you, Tanvi. It's my pleasure. Before I start, I just want to tell everyone that every surface, every bit of water, every air, which is around in your home and in my home, is alive. What do I mean by saying alive? It means they are having microbes or microorganisms. They are so tiny that we cannot see them. But if we want to see them, we have to take the help of a microscope. There are 5 groups of microbes known to all the school-going children, and that is bacteria, fungi, algae, protozoa, and virus. Now, COVID 2019 is caused by virus. So I'm just going to, share with you in a nutshell, what are viruses. Can I have the next slide? Now, we all know that viruses are the tiniest microbes, and you can find them everywhere. You can find them in your body, you can find them in animals, in plants, whichever organism is living. Next slide. Now, we have to remember a virus, when it is not inside a living organism or inside the body of a host, it is a non-living. When I say non-living, it's basically in the form of a crystal. And I think every school children will understand when I say the word crystal. All of you have seen a salt crystal or a sugar. Now, but once they enter into the body of a living organism, it starts living. And it is one characteristic which it shows, we call it a living organism, and that is the property of multiplication, reproduction. Next slide. Next slide, please. Now, like we all are made up of millions and billions and trillions of cells. And in each cell in our body, we have a controlling center, which we call as nucleus. And inside the nucleus, we have the genetic material, which is DNA or RNA. Now, a virus, inside a virus also, we have a genetic material, which can be a DNA or a RNA. Now, DNA stands for deoxyribonucleic acid, and RNA stands for ribose nucleic acid. Now, every virus around the genetic material, it has a protein code, which is known as capsid. And some of them, which are very, very resistant type, they have another envelope, which made of protein, which is known as envelope. And the envelopes might have tail, as in bacteriophage, or spikes. And once it enters into a host body, they start showing the process of replication. Next slide. Can I have the next slide, please? Now, all of you are familiar, every time we get a common cold, which is caused by a rhinovirus, a chickenpox, a varicella zoster virus, or polio, or measles. And there are some viruses which have a double envelope, like HIV, influenza virus, and COVID-19. Next one. Now, in short, I'm trying to tell you why we say the viruses are non-living. We have to remember that in each of us, in each of our body, we have mitochondria, which is having ATP, which is known as your energy currency, which gives us to do a lot of chemical reactions. Now, these viruses, they do not have their own ATP, a compound which is very necessary for many of our biochemical activities. Secondly, they do not have ribosomes, and ribosomes are very necessary to make proteins. That is why, they cannot thrive on their own. They need a host. So when they enter into a host body, they hijack the nucleus, they transfer the genetic material and their protein, and they start making their copies once they are inside it. Next cell form. And it's not really clear how or why it's happening, but in case of your SARS coronavirus 2, it is said to be originated, or it was said to be present in bat, and from the bat it has spilled over into humans. Now, all the students who are having pet at home, who are having cat and dog, I think all of you must be knowing it, that every year with the rabies injection, we are also giving coronavirus to our pet. So they are present everywhere. Now, the next slide. Now, this is the structure, there are lots on the internet, everywhere. This picture, I just want to tell you, and that it's a sphere in shape. You can see the spike, which are made of glycoprotein, and within that you have the envelope, and inside the envelope you have the helical RNA, that is a genomic RNA. Next slide. Now, how is coronavirus getting transmitted? How is it spreading so fast? Now, there are two things, which we have to keep in mind. It happens due to touch. Now, and they say wear a mask and wash your hand. Now, when we touch something which is already having the virus on it, and with our fingers, if we touch our nose, our mouth, our eyes, indirectly or directly, the virus enters into our body and we develop the COVID symptoms. And the other is respiratory, like cold. coronavirus is also spread through our respiratory droplets. When we talk, or when we sneeze, or when we cough, what are we doing? We are releasing them into the air. And if you are around, you will breathe them inside. Next slide. Now, every day from last December 2019, and people, and the symptoms, dry cough, fatigue, you're all the time feeling tired, you're having fever. So commonly we think, oh, it's just a common flu. But if the fever is quite high, keeps on persisting, and then you start feeling that you are losing your smell or the taste of the food or having problem breathing, then we should contact a doctor and we should have a medical attention to what is happening, or is it just a common cold or something further. Next slide. Now, this is something very interesting and which I want to share with you children. They will have everything to know about, but being a bio teacher and a subject which I love, and I call my subject as the living science, why is coronavirus so deadly? Now, I have mentioned two things, but before mentioning this, I want to tell you there are two main theories of classification for coronavirus. One is it belongs to coronavirus family, and the other is, which I'm going to say, the two classification theory, which is now is taxonomic, which is what I've told you, coronavirus, and others Baltimore. Now, according to Baltimore, a coronavirus acts like a pseudo retrovirus. Now, remember, when a virus is acting in a human or any host, it transfers information from a DNA into a RNA and so on. Now, the coronavirus is having a characteristic like a HIV. It is sending a message from the RNA into the DNA of the host, and this is known as your reverse transcription. And that is why you will find, or you must be hearing news or in newspaper, that the PCR positive tests have been reported in patients who have also recovered from COVID-19. It means that it is there inside the cell of the person who has been infected. Now, there is the second thing, which I'm going to talk about. Why it is so deadly? Because these coronavirus has entered into ACE2 receptors. Now, this is angiotensin converting enzyme, and the spike of the coronavirus attaches to these receptors, which are in large number human lungs. And that is why you will be hearing, people having lung-related problems and so on. Now then, how are you children or smaller children, younger to you, safe? Because these receptors develop very late in their life. And that is why small children are protected. That is why they are safe. Then another thing which is happening, and they're mutating so fast, and that is one, that is frame shift mutation. Now, all of you must be knowing it, those who are in senior classes. What is a codon? A codon is made up of 3 nitrogenous base, which is coding for a specific protein. Now, here I have given you an example, that suppose if we insert something or we delete something, the whole information of the protein changes. Now, here I have written Ram has a red cap. Now, if I insert just a RAMR, now a codon is made up of 3 nitrogen base. Now, what will happen? RAM will be there, but that R will shift with RHA, and then so on. So, what will happen? The whole message which is being coded on the messenger RNA will change, and it will result in a new object, a new information. And that is how these viruses are mutating so fast. Now, everywhere you are hearing, these days, the Delta variant of coronavirus is very virulent, very deadly. And Delta Plus is also very deadly everywhere, whether it's USA or you are hearing about Sydney or you are UK. Now, what is happening in them, these spikes in these Delta Plus cases, they are shortening their length and thickness, and the numbers increasing. And that is why they are more virulent, they are more deadly. Can I have the next slide? Now, this is something, we say that prevention is always better than cure, and WHO has said good hygiene and physical distancing are best way to protect yourself and everyone around you from COVID-19. And for that, children, I know all of you are much more smarter than us, and you are doing it. And with TERI, I have done so many school projects, and I know that you children are, what should I say, the eco warriors when you come for environment, and same thing comes for COVID, because you can make your parents, your friends, your relatives, everyone, even the people coming to your house, please wear a mask. Why? Because the mask protects from the respiratory droplets which are released in the air if someone is positive. And the other thing is keep a distance, because if we have a distance, they also have a certain lifespan, these droplets. So if we keep a distance, we will be safe. And the one thing which all of you know it, is washing your hand with soap or using an alcohol-based sanitizer. Now, all of you, and TERI has also done it before, the washing hand, and how it should be done, and how we should keep on doing, and touching every nook and corner of our fingers, so that none of the virus are left, And remember, when we start doing this activity, within 3 minutes, they start getting deactivated. And within 20 seconds, these viruses, the spike in the viruses, they start becoming denatured. Can I have the next slide? Now, why we are saying, soap can protect us from coronavirus, or why do we need to wear a mask? So just a small thing, chemistry, which all of you know, especially the students who are in class 10th, you have the chapter in chemistry, So please remember, what is spreading the infection? The infection is being spread because of the spike. The spike is the one which is spreading from one to another. And spike is also the weak point of a coronavirus, So if we are able to denature them, weaken them, we will protect ourselves. And for that, you have to remember a soap molecule chemically has got two parts. It has got a water loving, that is which we call as hydrophilic head, and a water hating part, hydrophobic tail. Now, when we mix the soap with water and we rub our hands, we scrub our hands, what is happening, the head gets attached to the water and the soap mixture, and the hydrophobic tail starts working on the spike and denatures it. And so is the action of your high alcohol content in the sanitizers. They also react with the lipid cell which is surrounding the coronavirus and denatures them. So this is in a nutshell, how this virus is acting, what is its genesis. Remember, it is made up of RNA, and the other genetic material is DNA. Remember, we all have DNA in each cell, nucleus of a cell. DNA is more stable because having double strand and having deoxyribose sugar, having thymine in nitrogenous base, whereas RNA is single strand, and it has uracil, which is very reactive, and 2OH group with the phosphate. Because of this, coronavirus is very liable, very reactive, and really spreading disease like fire everywhere. That's from me. I hope, children, you have been able to get something about the genesis of this virus.
Thank you, ma'am. This session was intriguing and had a lot of questions from students. Uh, Looking at the time, I'll just keep to 2 questions for now, and maybe if there is time enough, then we can take the other questions later. So there was this, there is one student who was asking that there was a rumor which was spread sometime back, ma'am, that virus is airborne and not spread through droplets. So what will be your take on it, ma'am?
I will say he is giving himself the answer, I would say it's not airborne, when we speak, when we talk, when we cough, what are we doing? I think all of you must have seen, some amount of water is released out from our mouth, or from our nose. And the virus which is inside our body, with these water droplets, are released in the air. So how do we say they are not airborne, And you will have so many myths, and if it was not airborne, how is it spreading so fast? So think about it, and if you do not want to think what I am saying, stop wearing your mask and start interacting and let me know, what happens, Yes, Taru, the next question.
Then the next question is that the person who is infected of the virus loses its tastes and smell. So why do you think this happens? And yeah.
Again, whoever was asked is a very interesting, and I really love it. When I was teaching bio in class 9th in the health chapter, what happens, when you have a common cold and cough, and then, you become lethargic, you don't want to do anything, and then you say, Mummy, aaj kya khana banaya? Koi taste nahi hai. And what is it? It is affecting your receptors, And same thing is happening by the coronavirus. So when you are infected, the receptors which are responsible for your taste, that is your gustatory, or the receptors which are responsible for your smell, all of you know it. So when they are affected, you're not getting it. So, the one main thing is to feel that, yes, I am affected by COVID. If you lose your taste and smell, please go to a doctor. Don't think it's a common cold, Yes, Taru? That's it.
Yes. Thank you, Ms. Mishra, for sharing your knowledge on viruses with us, and also for focusing in so much details on coronavirus. I'm sure students would have gained a little bit more knowledge on coronavirus and the science of viruses after your intellectual talk. So now I would request Dr. Prabhakar Sinha, WASH Specialist, UNICEF, Bihar Field Office, and Mr. Sudhakar Reddy, WASH Officer, UNICEF, Bihar Field Office, to apprise us about water sanitation and hygiene and its interlinkages with COVID-19. I would also like to mention that Dr. Sinha is a professional with an exceptional distinction of having founded an NGO at the age of 17 in the year 1986 and running it for almost 15 years. Dr. Sinha possesses an overall working experience of close to 3 decades in diverse thematic areas like child protection, urban poverty alleviation, public health, and WASH, with half of it exclusively on water and sanitation issues in different states including Bihar, Chhattisgarh, Himachal Pradesh, Jharkhand, Madhya Pradesh, Orissa, and Uttar Pradesh. Over to you, Dr. Sinha and Mr. Reddy.
Thank you, Tanvi. And thank you, my dear friends. I'm sure you must be overwhelmed with that huge introduction. So let me tell you, and you must be thinking that an old fellow must be coming with a boring lecture. So I'm not, and I apologize that my colleague couldn't join. Sudhakar has a meeting, and I will also have to leave for a meeting with GUI after this session. But it's always good to talk to the students, and just to remind myself that I also have been a student, and I'm still a student. I have a background with the school classroom setting. You can see that here. Uh, so now I will just quickly share my screen and start talking about we what is WASH actually. And I'm sure you all must be thinking of WASH. What is WASH? Let me see if I can still access the chat box, or perhaps Tanvi or Tanu will help me if there are comments in the chat box. What is WASH? Would you like to comment, either of them? Maybe a couple of you, 3, 4 of you would like to say what is WASH? What do you understand by WASH? In the chat box, quickly putting it in the chat box. Just a quick comment. Someone is typing? No one is typing?
Yes, sir. It seems students are typing. Yeah. So Adya Malvika has mentioned that it is water sanitation and hygiene,
Very good. Excellent. What else?
and to clean using fluids. Someone has mentioned, and the
Mhm.
clean the unwanted that is invisible. This is also
Okay, so I'll
response.
go with the first definition, and I don't want to get into all the details. But exactly, wash is, when we say wash, it's about water, sanitation, and hygiene. Can you see my screen on the presentation mode?
Yes, sir, it's
Okay.
visible.
And then we can also talk about sanitation, waste management, and cleanliness. Now, when we say sanitation, generally it's basically universal access to improved toilets and elimination of OD, that is open defecation, so that everyone has a toilet, everyone is using a toilet, and there's no human feces visible in the environment. Then it is, of course, personal hygiene and hand washing at all critical times, and integrated management of liquid and solid waste. What we understand, sanitation is that, and hygiene is here. So, what are the behaviors or what are the practices which need to be included? And I'm sure all of you must be doing most of it, but not all of it. That I can say for sure. So, building and use of toilets, I'm sure the clientele I'm talking to, the audience I'm talking to, must be having a toilet and is using them. But let me tell you, there are people, there are children in the country, in your state, in my state, who still do not have access to safe toilet, and they might be defecating somewhere in the open. So we have to see that they get a toilet and they do not defecate in the open. Safe disposal of child feces. Despite having a toilet, there are many families who are disposing of the child feces in the open, which needs to be contained safely and put it back into the toilets. So these, if you look around, uh, get out of your own family environment, school environment, and look around in the society, in the community, you'll find many such instances. Hand washing with soap in critical times. I'm sure many of you might not be doing that at times. Perhaps in last 1.5 years, hand washing practice has increased, as Dr. Bharti was also saying. And when it has to be done, we all know, but have we been practicing that? That's a big question. If we have not been, let's start doing it right now. And safe storage and handling of drinking water. We might be having access to the RO water or the filter water or something like that, but there are many families in our country who still do not have access to safe water. So we are working for that. UNICEF is working for that only. And solid and liquid waste management. Uh, People who are staying in big cities like Delhi, Mumbai, Lucknow, Bhopal, Ahmedabad, Pune, might not find it very difficult to understand that what is might find it difficult to understand that what is actually solid waste management, because someone is going to pick up the waste from their place, and it is being collected, transported, and disposed of. But there are very many areas in your towns, or even your cities, even if you look around, where there is a lack of proper solid waste management, and of course liquid waste management, liquid waste, that is gray water or water stagnation. Okay, let me have a quick question. One more question. Which of the below diseases and conditions are not transmitted via the fecal-oral route? I'm not looking at the chat box. Perhaps Tanvi and Tanu might tell me what are the responses. Just put A, B, C, D. What option you think is the fittest answer for conditions that are not transmitted, or the diseases which are not transmitted via the fecal-oral route? Is it
Okay, so
cholera,
most of
salmonellosis, viral diseases, trachoma?
so sir, most of the students are typing A, that is
Okay.
cholera. Yes.
So please mind that which of below diseases and conditions are not transmitted via the fecal-oral route. You need to understand, fecal-oral route is basically feces reaching your mouth somehow. There could be several ways. It could be through flies, it could be through fingers, it could be through fluid, that is drinking water, or any beverages for that matter. So which are the diseases associated with that?
So
So
sir, some of the students have also typed B and C. Very
okay.
few, yes.
So again, I won't go into the details. Actually, the answer is trachoma. Trachoma is, which is basically an eye infection, which is not transmitted through the fecal-oral route. Any disease like cholera, diarrhea, salmonellosis is caused due to salmonella, and any viral diarrhea is caused by fecal-oral route or fecal-oral transmission. Somehow, human feces reaching, getting into our food, getting into our environment, getting onto our fingers, hands, and that causes, we ingest feces, and that causes cholera or salmonellosis or viral diseases, viral diarrheas. But trachoma is basically a water wash disease. I will go to the next slide where you can find it out. We'll talk about that quickly. So trachoma is basically an eye infection which is caused due to scarcity of water or not cleaning or eye infection. So when we talk about water, sanitation, hygiene links to health, WASH has a direct link with health, malnourishment, and education. We need to understand that how it is affecting us as students, as citizens, as a general population in this country. So, as I said, that feces causes diarrhea, and it causes dehydration, which may lead to death also. And there are 1.8 million people every year which are who are dying from diarrhea every year, and 90%, my dear, mind it, 90% are children under 5, and these are mostly in developing countries like South Asian countries or African countries or perhaps South American countries. So we need to understand that what is the cause behind that. It's lack of sanitation. And at 88%, as it is mentioning, the data is mentioning that 88% of diarrheal diseases is attributed to unsafe water, inadequate sanitation, and hygiene. And if we have improved access to if we have access to improved water supply, it can reduce diarrhea up to 21%. Sanitation, improved sanitation, when I say improved water supply, it means that safe drinking water through pipe water supply or safe hand pumps, as most of the countryside, the rural areas have the hand pumps. But with new scheme, new water supply scheme, there have been rural water supply schemes, urban water supply schemes. So there's another mission which has been launched by Government of India, that is Jal Jeevan Mission, just like Swachh Bharat Mission. So both the missions actually focus on improving the sanitation and water supply condition in the country, just to address the health issues. And the simple act of hand washing might seem very simple thing, but it is very critical to save us from umpteen number of diseases, and it can bring down the morbidity and mortality to a great extent. This is, as I was talking about, um, waterborne, where you actually drink and eat. So it could be fecal contamination, feces getting into your food or water somehow, and we are ingesting that, and that is causing diarrhea, which is cholera, dysentery, typhoid, anything. And then water wash diseases are there. Then there are water based diseases or water related insects or vectors. So these are the examples. Trachoma, scabies are water washed, and bilharzia, guinea worm, or worms are caused due to they are transmitted through water waste. Now, if I talk about malnourishment, uh, so in India, almost half of children younger than 5 years of age are stunted. Now, what is stunting? If you look at the photograph above, stunting is low height for age. So at the age of 8 years, what should be the ideal height? And if children are not reaching that height, average height, that means they are affected by stunting. Or if they are not having weight as per their height, then that is called wasting. And stunting and wasting are two indicators of malnourishment in any part of the world. And in India, we have that, as I told, that almost half of children younger than 5 years of age are stunted. Now, why it is caused? So poor sanitation, it leads to diarrheal infections, which affects the absorption of food in the body. So it becomes like a leaking pot. You keep on putting water or something into it, and it is dripping out. So if we do not, if we aren't healthy, if we do not have safe drinking water, if we do not have proper sanitation, it may lead to so many infections, and thus it will affect the absorption of food intake. Whatever we eat is will not be absorbed properly. And as we say, कि बढ़ नहीं रहा है बच्चा. In Hindi, we often say, you might have heard this term in your family or in the vicinity, that बढ़ नहीं है बच्चे की. So that is basically that the food absorption is not at that level. And another fact is that one third of the undernourished children in the world live in India. So we are affected by that to that extent. Uh, there's a Rice Institute where research by Dean Spears says that open defecation plus population density accounts for 65% of undernutrition. So these are some of the facts which I am trying to uh, tell you. I want to underline the fact that wash is so important, it's so significant that it affects our health, it affects our nourishment status, and it affects our education status as well. How? If you do not have proper wash facilities in the school, suppose you are in the school and you do not you have diarrheal infection and you want to go to the toilet and you do not have a toilet or a functional toilet or a proper clean toilet, perhaps you will say, oh, I won't go to the school, I'll skip the school. Of course, we have been away from the school for the last 1.5 years, but earlier also, and maybe in future, God willing, we will be going to the schools soon. But still, so you would refrain from going to the school, and many of my dear children would be girls who have a particular period when passing through menstruation. They need safety, they need privacy, they need some space for themselves, and if the school doesn't have proper functional clean toilets, they would prefer to skip the schools. And it might not be such a urban phenomena, but in rural areas it is. Girls they skip the school. If you say that girls are typically absent for 20% of the school year due to menstruation, and that is the major reason, because if they do not have facilities, privacy required in the schools, they won't be able to attend the schools. And 23% girls are dropping out of school on reaching puberty. This is largely for the rural areas, but areas as well. So we need to ensure that the schools have basic wash facilities. They are clean, they are functional, which is very important. And you are really privileged one if you have those facilities in your schools. And just look around and see how many of them, how many of the children do not have, and how can we help them. So a proper wash facility provides healthy, safe, and secure school environment. It helps ensure quality education, because if you are in the school, if you have those basic facilities, drinking water, toilet, hand washing facility, then perhaps you'll feel better in the school and you'll be attentive in the classes, and it will improve the quality education and encourages children's pride in the schools that okay, my school has these facilities. Yeah, you might be boasting that okay, my school has such a huge library. Oh, I have computers, I have this, all these things. But am I? Have you lost me? Is the presentation visible?
Sir, we can see wash in education slide right now.
Okay, fine. So I'm just moving on.
Okay.
And then you are the change agents. If we invest in the school children and the health, this is basically investing in the future. So whatever we are investing in school infrastructure is basically is an investment in you, the young population, the young generation, and you are going to take it forward, not in terms of health or better nutrition or education, but also as a habit, as a value framework, which you will perhaps when you are out in the professional world, wherever you are, you will be promoting those values. Now, coming on to the COVID, which of course Bharti ji has talked in detail, I'll just talk of three things. That uh, it's about covering your face while sneezing and coughing. It's washing hands. Perhaps it might pass through fingers, so it is required to clean your hands, wash your hands, or use alcohol-based sanitizer, and then cleaning or disinfecting the surfaces. These are the three basic habits which are required, practices which are required at all levels, especially in schools. When we come to the schools, we talk about that. So these are the things: masking, the regular hand washing, and physical distancing. Now, when I come to the key wash and IPC protocols, now what is IPC? We might have heard of interpersonal communication, but here it is infection prevention and control protocols for schools. So Government of India has worked. We have worked with Government of India. We are working with the state government to come up with standard infection prevention control measures, which we call safe school protocols. So when the schools will be reopening, what all needs to be done and what all are the areas where it needs to be done. So water supply is one area, sanitation is another, personal hygiene, food and midday meal hygiene. In many of the in all the government schools, they provide midday meals. Even in many of your schools, you might be having breakfast and lunch being provided from the school, or perhaps you, if you are getting it there. Then environmental cleanliness, waste management, and operation maintenance of wash facilities. So all these form a part of the key wash measures to have interpersonal, infection prevention control in the schools. Now, if we are talking about water, we are talking about hand washing a lot. We are talking about toilet usage, but where is the water? So we need to ensure that the schools have they have accessibility to water and they have adequate water as per the school strength. So adequate quantity and quality of drinking water. Many of the areas in the country are water quality affected areas, whether it could be arsenic or fluoride or iron. And the state which I am talking from, Bihar, has out of 38 districts, around 29 districts are affected by water quality issues, either arsenic or fluoride or iron, or perhaps iron and arsenic both. So uh, water quality is a major issue that we provide safe drinking water. Running water in the taps is very important for hand washing, for cleanliness of toilet, and for personal use, especially menstrual hygiene management also. So if the toilets are there, there has to be taps with running water. Many of you might find it very surprising that, okay, he's talking about running water, taps in the toilets or running water in the taps. But that's a fact that many many schools in the country do not have taps in the toilets, or they have running water in the taps, or they just have hand pumps perhaps. So we have to think that way also, because your entire project is focusing on all these issues, and our purpose is to inform you, sensitize you, make you aware on those issues. Now, do we have pedal operated taps to minimize hand contacts with COVID onslaught? We have to ensure that there's physical distancing and there's minimum touch. So there are examples of no touch or minimal touch pedal operated taps and hand washing stations, which UNICEF has established, installed at many places. We are working with governments in different states to install it at public places or in the schools, so that there's minimum or no touch, and there's no possibility of the possibility of infection is reduced. Taps are regularly clean. If there are taps which are to be used, they need to be disinfected or cleaned regularly. Uh, Maybe if you are in the school, many of these children, we are advising that don't drink from water directly from the hand pump, because it will require pumping it, and then perhaps you might get infected if someone has got it, has touched it, who was infected. Or maybe start using reusable drinking water bottles. There are challenges of using bottles or reusable bottles, and plastic bottles especially, but we have to find a way out, and we are trying to do that, and this is what we want to inform you also. uh, and then the bottles also need to be clean and disinfected when you go back home, or when the children are going back home. Then cleaning and disinfection of storage containers. If I do not know if you are aware of where is your water coming from. If you do not know, you go and ask your parents, or perhaps your family, someone, or your school, someone in the school, that where is the water coming from? Is there any storage? When was it clean last time? So there's a requirement of cleaning and disinfecting the storage container also, whether it's the tank or a tank, or it's a small container at the school level. So that needs to be properly cleaned and disinfected, and ensure proper chlorination. It goes with the quality of water. So when we are ensuring the quality, it's not only addressing the water quality in those terms, it has to be chlorinated also. Now, if you come on to the sanitation part, I talked about water supply, drinking water. Now I'm talking about the sanitation. When we say human feces or fecal contamination, I was talking about. So human feces is the most common source of microbial pathogens. I am not going to count those numbers. You can count it, how many units, or hundreds of thousands, or whatever thousands it is. But 1 gram of human feces has so many pathogens. And just imagine if someone is going out for open defecation. Normally, a person would be, we do an exercise called fecal load assessment. So, how much do you defecate? Had it been a physical workshop, that would have led you to, you must be laughing at that question, that how much actually you defecate. But this is, if you work out the load, that so many people, if they are going outside, if like NFHS says, NFHS 5, which is Initial Family Health Survey, fifth, which has recently been done. It's a countrywide survey which is done periodically. So it says that in Bihar, for example, 47.4% people have access to safe toilet, or they are, so rest of the people are defecating in the open. And this is recorded data. Of course, it is slightly old, but perhaps if you say even 30% of people are defecating in the open, or if you go in the town, you can find many people defecating in at the roadside or near the nala or anywhere, and you can see them often. So if they're defecating, say 150 grams or 200 grams or 250 grams, and there are 1,000 people defecating in the open, for example, what is the load of pathogens which is in the open environment, which may infect us with that? And though there are very remote possibilities, but there have been chances where even um, COVID, coronavirus has been found in human feces. So there are very remote chances of it spreading, but we have to ensure there should be no open defecation. So if there are proper sanitation system, proper toilets, they prevent the spread of many diseases. And we have to ensure that schools have proper number of toilets, adequate number of toilets, and that are gender segregated too, or perhaps differently able friendly. So do we have toilets for girls, separate toilet for girls? Do we have separate toilet for differently able children? So we have to ensure that these are available there. And there are areas where these are not available, where for which we all need to work together. Now, if there are toilets, do they have latches? They are regularly clean, infected, disinfected, or not? So we have to ensure that all the common points which are touched in the sanitation system, whether it's door, latches, buckets, mugs, or taps, they should be cleaned properly with 1% hypochlorite solution and toilet detergents. Do we have adequate supplies in the school about for cleaning the toilets? If the so next time when you are going to the schools, just observe your janitor, sanitation janitor. Look at the great job, the most important job he or she is doing. They are cleaning the toilet for us, for our safety. So let's respect them. They should be given that sort of respect. They deserve that respect, that they are cleaning our toilets, and they are ensuring that we do not get infected. So are they protected? Do they have basic personal protection equipments or not? Boots, gloves, masks, etc. And are they trained on cleaning the toilet and disinfection practices or not? And do they have adequate supplies to perform their duties, or not? And then when we talk about uh, the toilets, what about the on-site elimination of fecal material? So in urban areas, many of you might have the toilets which are connected to the sewer lines, but there are many toilets which are septic tank based. So when you go, you try to find it out how, like at your home, what is the toilet, which type of toilet it is, and where all that feces is going. Is it going to a sewer network, or is it going to a septic tank? In most of the suburbs, or the colonies settled in the suburbs, they are basically septic tanks, because uh, a major part of our cities is not connected through sewer network. So, and especially the smaller towns. So where is that feces going? So these septic tanks require periodic desludging also. and how is it being done? Is it being safely done? You might have seen honeysuckers at times, if you are observant, or if you are not, please do try to find out how these septic tanks are emptied, where this sludge is going. Is it being disposed of safely or not? Is it not being put into an open drain? Is it not being put into a farm, or near the trees or something like that? So we have to be vigilant about that. Then only we'll be able to understand that are we really protecting ourselves or not. I have talked about water supply, sanitation, now hand hygiene. I don't want to dwell much upon that because most of you know. But we have to be sure that we do not touch our nose, and eyes and mouth frequently after touching surfaces or people. Uh, Hugs are like they are things of past. Maybe in future, God willing, we'll be able to hug each other soon. But as of now, it is restricted. Touches are restricted. Unwashed hands should be avoided. So we need to ensure that if we are touching handrails, tabletops, toys, lifts, so staircases, anything. So we should come back home and immediately clean our hands with soap and water, or use a alcohol-based sanitizer. I would suggest that minimize the use of alcohol-based sanitizers. Try to clean your hands with soap and water more often. If that is not available, then perhaps you can use sanitizers also. Respiratory hygiene is important because when we are sneezing or coughing, how are we doing? Are we using the tissue? So if we are using the tissue, let's put it in a covered dustbin immediately. So it is safely disposed of. If we are sneezing and coughing, let's turn our head away. If we do not have anything quickly, hanky or a tissue or anything, let's use our sleeves like that and let's sneeze. So these are the basic respiratory etiquettes which are required now. Now, when we are getting online classes, online sessions, online workshops, webinars, then we are learning lot many digital etiquettes also, and these are about the respiratory etiquettes. What all we need to learn. And once we sneeze, and if we have used bare hands, let's go and wash our hands with soap and water. And as I said, that avoid touching your eyes, nose, and mouths if hands have not been disinfected properly. And do not spit in public places. Do not uh, 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 like stop people spitting in public places. We often have the habits of when we are outside. Let's not do it. Let's think that if we are in our drawing room, are we going to do the same thing? And if we are not going to do it the same thing in our drawing rooms or bedrooms or kitchen, let's not do it in the open space also. And let's stop people doing that. And because, as I said, you are the change agent, you are going to influence people, you are going to influence your parents, your families, your friends, each other. So it's you who will take the message across. Physical distancing we have talked about. When you are going back to the schools, you need to be very cautious, very alert, very vigilant, that you do not get that close that you may infect your colleague, or your friends might infect you if they have some sort of infection. And especially with the second wave, we have learned that there have been non-asymptomatic patients also. So we have to be very careful. We're not sure is the third wave coming, it isn't coming, when it is coming, or when it is going to end. But prevention is the only cure. Let's be careful. That's it. If we are sitting in the classes, let's leave one chair vacant. And the schools would be making those arrangements because the directives are going to the schools as well. All the schools have got the directives, and all the schools and management are actually concerned about their students. They will be taking care of that. But if in case you think that your school or someone, some school, either of the schools nearby are not taking care, perhaps you as a group can go and tell them that you need to take that, or perhaps you can raise this at a right forum. You can seek guidance from your teachers, your principal, how we can ensure or sensitize people around the schools, around the smaller schools which do not have that much of infrastructure facilities. So physical distancing is important, and there are ways to do ensure that physical distancing once you are in the school. So these pictures are from rural areas. You may like to see that how what type of schools they are and how they are maintained. Now, I'm talking about the food hygiene. Now, many of your schools might be cooking foods even. There are schools which provide breakfast and lunch also. And in rural areas, in most of the government schools, the midday meal is provided. So, food stores need to be kept clean and disinfected periodically, whether it's twice a day, thrice a day. Windows should be open, raw material should be clean, utensils and cutlery must be sanitized. Cooks must wash their hands. If you see in the picture, this is the picture above is before COVID. So these cooks are not putting on the mask or they are not putting on the gloves, but their hands should be clean. They should wash their hands properly and then cook the food. Of course, when we are cooking at home, also we can't put on the mask every time. So our hands should be clean. That's more important, and we should be cooking, or anyone who's cooking in the family should be doing that. Wearing a mask. So you can see in the picture below, the characters are putting on a mask. So that is required with the new norms. It should be new norm: physical distancing, masking, and hand washing. And students who are going to have their food need to clean their wash their hands, and that is something which teachers and parents have been telling us since ages. So another old person with 3 decades experience or 3 decades working experience, as Tanvi was introducing me, is telling you again that please, please, please wash your hands and maintain physical distance and use mask. So coming on to use mask, how you are using mask, but that is very important. If you are using mask like that, or like that, or like that, so you need to see that the mask has to be like that, so that your nostrils, your lips, your chin is covered, and you do not like if you sneeze, someone is not infected. And there are single-use masks which should be disposed of safely. There are cotton masks that can be used multiple times, but they need to be cleaned, washed, dried, and then used. Uh, if you are moving into the crowded areas, ICMR is also suggesting that let's use double mask. So one mask should be a surgical mask, and then you can put on another
Dr.
mask.
Sin,
That's fine. And if it
Dr.
is
Sin,
N95 mask, you do not need any other mask.
Dr. Sinha, I'm really sorry to interrupt, and with due apologies, we are actually running a
So
little.
I'll just take 5 minutes or perhaps 2, 3 minutes, and I'll close it. I'm just uh, reaching my slides, ending my slides
Sure,
quickly.
sure,
Another couple of slides. Yes.
sure.
So environmental cleaning, we have already talked about. The spaces should be clean, disinfected, frequently touched objects should be disinfected, detergent should be used. All these are basically now for the teachers and the management how it has to be clean. But the students, the children must be knowing what needs to be. There has to be a cleaning and disinfection schedule. How is your toilet being cleaned, and when, how many times it is being cleaned? That should be mentioned. Solid waste management, where are you throwing your waste? And there are two types of bins you can say, green and blue. So blue bins are normally used for dry waste, and green bins are used for wet waste. So we have to ensure that the waste is properly put into a safe bin, and it is disposed of safely. So foot operated bins. What about the menstrual waste? How is it being collected and disposed of? So we have to ensure that do the schools have incinerators attached with the girls' toilet or not? Many of your schools might have, they might not have. But what is important is safe disposal of menstrual waste, tissues used for cough and sneeze, and other solid waste. Then water stagnation is a big problem. Do we have proper drainage? Where's the water going? Is it just going into the open drains, or is it going into the soakage pit? What is gray water? I would just like to spend a second here. Gray water is basically which is the water coming out of the bathrooms or the kitchens or the washrooms. But the toilet water, the water mixed with urine or feces is basically black water. So black water should not get into open. It needs to be contained safely through soakage pit or leach pits. And the gray water should be either through a soak page, it should be contained, or it should be treated and it can be reused also. In many colonies, many urban area spaces, it is being treated and reused. And then finally, if we have these facilities, they need to be properly maintained. As I told you that what is the schedule for maintenance, who's supervising, do we have adequate cleaning and disinfection supplies, are we checking up the pipeline breakages or leakages? So all these things should be, facilities should be reviewed periodically, inspected periodically, and maintained periodically. So that's from my side. Thank you so very much.
Thank you so much, sir. And really sorry we had to interrupt.
It's
As you
fine.
know, we're running a little behind the schedule. So uh, now I would request and I would invite all our distinguished guests to join us in symbolic launch of the Sehat portal that has been created as a part of promoting science and health communication through outreach and capacity building of school students and linked communities. So Sehat is an acronym, which is used for science education and health awareness tool. I would request my colleague Ms. Rita Sharma, Associate Fellow, Knowledge Resource Center, TERI, to familiarize all of us with this portal. Over to you, Ms. Rita.
Thank you, Tanvi. And good afternoon and very warm welcome to this portal launch from TERI to all the participants and my fellow panelists and users who are going to use this portal. A month of hard efforts had gone from TERI to collect, collate and design to this portal. And now we have come to launching stage of this portal. So I'm sharing my screen. Is my screen visible?
Yes.
Okay, I'm putting this in full mode. So now I welcome all of you in this portal launch. And now here I'm launching the portal. So it's my privilege to take you all to the virtual tool of this website. The objective of the portal is to provide knowledge. Yes, this is the front page of the portal. And the objective of the portal is to provide knowledge and information on COVID-19 health behavior and individual response to deal with the problem. In this portal, you can see that on the front page itself, we have put three banners where you will find the launch of the event related information. Like here, we have posted launch event of the project. Then we have this comic strip competitions information is also in the next banner strip. And you will get the latest information about the any kind of competition and activities directly from this banner itself time to time. And under knowledge resources centers, we have compiled a list of books, infographics, news and articles, success stories, videos, events related to COVID-19 and its appropriate behavior. So when you click on the book, so these all the knowledge resources have been collected from various authenticated sources so that you cannot tap into any kind of websites which are fake or which are providing not so useful information. So you can see these books, and we have these books. We have listed a few books here. Right now, we have provided little resources here, but we will add more resources in the coming time in this portal. So we have provided the information about these books till abstract level. But if you want to read the full text of these books, we have given the link directly to the website of IASC. So when you click on this URL, you can directly read the full document of this book, My Hero Is You. So same way you can also read other books which we have listed in, on this portal. So infographic already Tanvi has explained that there are lots of 4 infographics prepared under these projects, and in coming months there will be more infographic from where you can collect information regarding what is corona and what is the corona, the appropriate COVID related appropriate behavior, how you can use mask. So through this poster you can get the information related to this COVID-19. Then we have uploaded news and articles, any kind of latest information, especially in context to the children's and the linked communities. You can get all these informations, latest news and articles from various authenticated sources, as I just mentioned, like Nature, Indian Express. So whatever is latest published in the field of COVID-19 and the pandemic, we will regularly update these news and articles on these portals. Then we have success stories. So you can read these success stories and you can get inspired how you can utilize your time in the pandemic. Then we have videos which you can watch. There are various useful videos here. These are videos which are produced by the TERI and the other organization. Then we have events. So right now we have listed few events here, which you can, if your parents or teachers or students want to participate, you can participate. Later on, we will also upload the events related to these projects also in this page. In Play and Learn, we have given these tabs competitions. Whatever competition will be launched under this project, we will updated all the information related to those competition here. And you can participate in this competition directly from this web portal. You can submit your activity from here. So for submitting activity, for accessing knowledge resources, you need not require any kind of login. But if you want to submit and in any activity or participate in any kind of competition, which we will launch on monthly basis through this portal. So you have to log in. And for login, you have to give your credential here. In case if for activities for kids, we have posted the activity like how can wash play a significant role in defeating COVID-19. So you can participate in this activity by logging to the portal, and you can also post your like how much you have scored by playing these or by participating in this kind of activity, and the best players or the scores will be published on this website, and they might be divided based on the activity performed. Then we have under explore more, we have given links to very some of the useful website like WWF, where you can engage and play other educational based games. Under share your feedback, you can share your feedback with us about the improvement of the portal, or you can give suggestions to us, or you can directly connect to us, or you can submit some kind of write-up through this feedback section to us, which will be later on, we can, if it is good, so we can also publish on this portal. Let's go to the home page. So you can see here the brain buzz. So we will monthly post some kind of quiz for you, which you can participate. This section is basically dedicated to engage students in a dialogue on contemporary issues, like we have posted here, what is herd community. So I request all of you to please share this among your friend circle, and you can you also start participating in this discussion forum, what is herd community, and start typing your answers here. So this is a very useful activity which you can play, and on monthly basis we will update this activity. Let's go to the home page again. Then you can also get the information on about the competition here. News and article I have already explained. Infographic I have just shown you. Under announcement section, we will regularly post the the various announcement, your results will be just announced after this portal launch, during this portal launch. So we will also post the winner's name through this announcement section also. So if you want to see later on those who missed, they can also see their winner's name through this portal. So this is all about the portal on portal Sehat portal, and I request you all to please keep on visiting this portal so that you will be more familiar with the portal, and you can will get maximum benefit of the knowledge resources added by us, and you can participate in various activities and competitions time to time will be organized by the TERI. So thank you all.
Thank you, Miss Rita. Thank you for sharing about the portal in so much detail. And I would like to give a special thanks to our Knowledge Resource Center team as well as our IT teams for preparing such an interactive and beautiful portal. I am sure our students are going to enjoy it thoroughly. And we'll keep posting new things, new activities. So I request all the students to just keep yourself updated by visiting this portal. So finally, now, since all of you and a lot of you have been asking about when will the results will be declared, when will we get the winner award or whatever. So now we now come to the most exciting and the much awaited moment where we will be felicitating the winners of the comic strip competition, which was held as a precursor to the launch of the project. I would request my colleague, Ms. Monmi Barua, Associate Fellow EEA TERI, to kindly announce the winners. Over to you, Monmi. All the best to all the participants.
Thank you so much, Tanvi. And yes, we have been getting a lot of messages right now, and it's very overwhelming to see so many students have been interested and have taken part in the competition. And to let you know that we have got around more than 560 entries. So it has been a very overwhelming response from everyone, and we have been very fortunate to go through the entries. And let me tell you, we as our whole team as a team, we were it was very difficult for us to actually go through to select the best entries, because there's always a winner. But and I would just want to congratulate everyone that this competition was an eye opening for us as well, that students actually very actively have taken part. And to see, it was very difficult for us to judge also, because most of them have given their best, and it was really very overwhelming for us. And okay, my screen, I have just shared my screen, and it is taking some time, but yeah, before that, yeah, just give me some more time. And I'm sorry, I think there has been some technical issue, I guess. Yes, I think if someone can share, because from here, actually my system has been stuck.
I will do it. Just a
Yeah.
second.
I know we are all been waiting. We have all been waiting for this particular moment, and it's been taking some more time. But yeah, we will be getting it soon.
Is the screen visible now?
Not really.
Oh my god. It's okay, it's okay.
No, I'm.
Is it visible now?
Yeah, yeah, it's visible. It's visible.
Okay, okay. So, I think Monmi has some network issues. So, one second, we'll just get back.
All right. So yeah, Tanvi, can you? Yes. So for the winners, let's move on to the next slide. As you all know, for the we the topic was on COVID, fighting COVID, and it was on comic strip. So it was for the students from classes 7 to 10, and particularly aged from 12 to 15 years. And this was the criteria, the screen that you can see right now. We had the following criteria for choosing, and we had three stages of selection actually. And I mean, apart from Bangalore, apart from in fact Karnataka, Delhi NCR, Maharashtra, and West Bengal, we also had entries from Assam. We extended our entries to Assam as well, to schools from Assam. So they have also been a part of this competition. And so content, relevance, flow, and visual aesthetic, and the impact, which was the most important thing, was also a part of judging the criteria. So yes, let's move on to the next slide. So for the comic strip, for the third position, we have Ira Sultan. Congratulations, Ira. And she's from class 7 and from DPS Public School, Arkipuram, New Delhi. Congratulations. I hope Ira is, is here, is attending the session. For the second prize, we have Tavishi Jam, and she is a 9th standard student, and she's from Sachdeva Public School, Maurya Enclave, Pitampura, Delhi. Congratulations, Tavishi. And the first prize, it goes to Akanksha Das. She is a 10th standard student from Srimanta Shankar Academy, Senior Secondary School, Dispur, Guwahati, Assam. So congratulations to all the winners, and it has been, like I mentioned, it has been a great pleasure judging all the entries, and it took us some effort to judge all the, more than 560 entries, and it's always there. We always need to have winners in the end. So these are the top three winners. Otherwise, all were very good, and we actually felt very good to actually see these entries. So thank you so much, and thank you all students also for participating in the competition. Over to you, Tanvi. Thank you.
Thank you, Monvi, and congratulations to all the winners. And please, others, don't be disheartened. We have a lot many competitions and activities coming up for you in next few months. So maybe next time you can be the winner. So just please note that all the participating students will get an e-certificate, and the winners will be getting merit certificates and prizes. In addition, their work will be published as knowledge products with due credit to the creator. Congratulations once again. So I would now like to familiarize you all with the immediate deliverables, the activities that we have for you in the next 1 to 2 months. So, is my screen visible?
Ravi, please mute your mic.
Now? Yes. All right. Okay. So, now moving ahead with the way forward. So, first of all, what we plan to do is to promote scientific temper. My colleagues have already told you a lot about the project, but in brief, so firstly, promoting scientific temper, then generating positive stories of adaptation and demystifying the myths, approach, methodologies, and communication tools that will be used as a part of this project will attempt to translate knowledge into positive behaviors. So ultimately, what we plan to reach is to reap responsible actions to curb the effects of the deadly virus. So moving ahead with the way forward, the immediate next activity that will be posted on the portal and will also be mailed to you is the perception survey. So it's a survey form which will be activated where students will be required to fill a form with few multiple choice questions, and these questions will be related to how you perceive COVID-19 and what changes have you adopted in your behaviors because of this pandemic has certainly led to a lot of changes in our lifestyles. So just to understand how you perceive COVID-19 and what have you done, this perception survey is going to be a very small questionnaire. Let me tell you, it's not going to be a big one, it is a very small one. And then the next thing that will be posted and launched would be the video competition. So students will be addressing, we will be sharing guidelines of this competition, and all the students who will be participating will be addressing few questions in the video and will be submitting to us. And these questions will also be related to COVID-19 and the new lifestyles that you have adopted, the changes that have occurred due to the pandemic in your lives. And for this, the winners will be provided with certificates, as well as their message, the video message will be showcased in the final project video, which will be prepared from voice across the nation. So across India we are going to launch this competition, and the best entries will be collated, and a good video will be prepared, which will then definitely be circulated through YouTube, through Facebook. There will be a mass circulation of this video. So this is, the videos will be given credits, and different guidelines will be definitely shared with you all. Apart from this, along the time, there will be workshops for educators and students. Since today was the launch workshop, there will be some knowledge based workshops, then some interactive workshops, and such workshops will keep on going for the students as well as for the educators. So this is a very brief thing about the immediate next things that we will be doing. And yes, so with this we now conclude the workshop. And also, if you have any queries regarding the project activities or what you have to do, what is the role of teachers, students, you can definitely write us back to our respective email IDs, which will definitely be given to you while we send the mails. And before we finally move ahead with the uh, conclusion of the workshop, I would request all of you to please open up your videos so that we can have a group photograph. Is it possible, Ravi? Can everybody just open up the videos?
Yeah, I have given the access.
All right. So all of you who are there still can just open up their videos, and we'll have a group photograph. Okay, so on count of 1, 2, 3, we all will say cheese. All right. So Ravi, you can just click it once we all say cheese. So 1, 2, and 3. Say cheese. Okay, good.
Done.
All right. Thank you so much, Ravi. And thank you all the students for letting us see your faces. Okay. So now, honorable speakers, our most valuable participants, it is my privilege to propose a vote of thanks on this occasion. I, Ms. Tanvi Sharma, on behalf of TERI, would like to extend a very hearty vote of thanks to the honorable delegates who took out time of their busy schedules to grace the occasion with their presence today. A big thank you to Dr. Pamposh Kumar for always believing in us and providing us with an opportunity to implement this praiseworthy project. He couldn't join us today because of his other engagements, but surely in upcoming events and activities, you'll get a chance to interact with different officials from DST. So I must mention a deep sense of appreciation to Ms. Bharti Mishra for being here with us today and sharing her knowledge on science behind a virus. It was a great session, ma'am. Further, we are grateful to Dr. Prabhakar Sinha for beautifully putting across the interlinkages between WASH and COVID-19. I would like to thank Dr. Livleen for her continuous guidance and trust that she has on us to make such projects a great success. We all are inspired by her great words. We at TERI would like to take this opportunity to thank our sponsors, National Council for Science and Technology Communication, Department of Science and Technology, Government of India. I would also like to extend my thanks to our teams from IT and Knowledge Resource Center for their enormous support in bringing out Sehat portal. Besides this, we have also been fortunate enough to have been backed by a strong team. Dr. Livleen, Ms. Taru, Ms. Monmi, Mr. Ravi, Ms. Harika from TERI. Lastly, I cannot thank everyone enough who have attended the project launch today and were actively engaged throughout the event. Thank you for being with us this afternoon. It is a great pleasure. Thank you very much, and let us just hope for a successful implementation of this project. Thank you. And also, sorry, I forgot to mention, we are posting a link to, we obviously we need your feedback for how was the launch and what would you like us to do better for in the next activities. So we are posting a link in the chat box where, you can just open and fill the, Ravi has shared a link. You can just open it and fill out your feedback, and we'll be happy to accept it. Thank you so much.
Thank you all. Bye bye.
Thank you all. Bye bye. Have a nice day.